please? Okay, are you ready?
I'm ready. Good.
Okay, so welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors meeting. Today's meeting is officially called to order. Please note for the record, Dr. Michelle Morse is representing Dr. Dave Shoxi, Scott French representing Stephen Banks, and Philip Wadley representing Deputy Mayor Melanie Hartzog, all in a voting capacity. Next on the agenda is the adoption of the minutes of the board meeting held September 30th, 2021. Are there any questions, comments, or suggested changes? Can I hear a motion to accept these minutes? Okay, so let me ask for your vote one by one. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Morse?
Yes.
Dr. Cunningham?
Yes.
Mr. Wadley?
Yes.
Scott French?
Yes.
Barbara Lowe?
Yes.
Bob Nolan?
Yes.
Sally Hernandez Piñeiro?
Yes.
Frida Wang? Frida?
Yes.
Thank you. Fenioski Peña Mora? Fenioski Peña Mora?
Sorry. Yeah, wait a second.
And, okay.
Can you read
and
the
yeah,
sorry.
it was
you read
adoption
the
of the
numbers?
minutes. It was adoption of the minutes. So say
Oh, yes.
yes or no.
Yes,
Okay.
thank you.
And Anita Kawatra?
Yes.
Thank you. So the minutes have been approved. So as mandated by Section 3B of the bylaws, at each meeting of the board, the executive committee shall make a report of all actions taken by it since its last report to the board. The executive committee met on October 4th, 2021 to consider and approve a contract with LIC Com LLC to provide home delivery of emergency meals to food insecure New Yorkers in COVID quarantine and isolation, not to exceed $10 million for the period November 1st, 2021 through June 30th, 2022. Dr. Long will highlight the need for these services. So, Dr. Long?
Yes, in brief, our ability to help New Yorkers to successfully stay at home if they're in isolation, meaning they're a case with COVID, or if they've been exposed to somebody or they're a close contact in quarantine, has really been a cornerstone of our approach to COVID in New York City. It's something that sets us aside from the other cities in the country. And one of the ways that we've been able to do this is by delivering food to you at home, so you don't have to leave your home in order to feed yourself and your family. We've been very successful with this. We've done hundreds of thousands of times keeping New York City safe by allowing people to stay at home, to isolate and quarantine. We want to continue that good work through this, through the arrangement with LIC Com for not to exceed of $10 million. They're an MWBE who has performed well for us so far in the fight against COVID. And we want to continue to be able to offer this critical resource to New Yorkers while COVID is still a threat to New York City.
Thank you, Dr. Long. So I would like to propose a motion to accept the minutes of the executive committee meeting held on October 4th, 2021. Can I please have a second?
So moved. Second.
Are there any questions or on the minutes? Yeah.
No, the minutes on. I'm Dr.
Yeah.
Ed. I know as the president of the senior center in the Bronx, that the mayor has this whole separate programs and feeding millions of people for years. Is this targeted to the HAC world and patients who leave our hospitals and go home? Is that our clientele?
It's actually a bit broader than that. Great question, because there's a variety of programs across New York City that pertain to giving people food and delivering food to them. This would be specifically what we would continue as part of the fight against COVID. So anybody diagnosed with COVID that comes through the front door of our contact tracing program, we'd offer to deliver you food so that you could stay at home and not have to go to the grocery store. Or if you're a close contact, somebody that's been directly exposed that needs to quarantine because you're at risk for becoming contagious and going and potentially infecting your community, this would also allow us to deliver food to you to stay at home so you wouldn't have to go to the grocery store and potentially risk infecting other people.
Thank you very much. That's
Yeah.
great.
Thank you. Okay, so let me then get the votes. Dr. Katz,
Yes.
Dr. Calamia,
Yes.
Dr. Morse,
Yes.
Dr. Cunningham,
Yes.
Philip Wadley,
Yes.
Scott French,
Yes.
Barbara Lowe,
Yes.
Robert Nolan,
Yes.
Sally Hernandez Pinheiro,
Yes.
Frida Wang, Frida,
Yes.
Fenioski Peñamora,
Yes.
and Anita Kawatra.
Yes.
Thank you so much. So the minutes have been accepted. So during the executive session, the board received, thank you.
Thank you.
Long. During the executive session, the board received and approved oral and written governing body submissions from NYCH and H Coney Island and Seaview Nursing and Rehabilitation Center. The board received and approved governing body written submission of the NYC Health and Hospitals Renaissance Diagnostic and Treatment Gotham Center 2020 Performance Improvement Plan and Evaluation, and the board received and approved semi-annual governing body reports. These are written submissions from NYC Health and Hospitals Kohler Nursing Facility, Henry J. Carter Special Hospital, and Henry J. Carter Nursing Facility. So let me now move to I'm gonna move things around a little bit, so move to the resolution. So Mr. Peñamora, do you wanna get started with resolution item number 5 on the agenda? Penioski?
Yes. Okay, sorry. Yes. Can you hear me now?
Yeah. So would you read the resolution?
Can me?
Yes.
Yes. Okay.
Yes, we can.
Authorizing the New York City Health and Hospital Corporation, the system, to execute a revocable 5-year license agreement with Newton Dialysis Center Incorporated of New York, the licensee, for its continued use and occupancy of 6,006 square feet of space to operate a renal dialysis center. $71 per square foot
Penioski,
or $426 per year to be escalated by 2.7%.
Penioski, I'll go ahead and read it. Okay? There's a signal issue going on.
Okay, you cannot hear me.
Okay, so authorizing the New York City Health and Hospitals Corporation, the system, to execute a revocable 5-year license agreement with Newton Dialysis Center, Inc. of New York, the licensee, for its continued use and occupancy of 6,006 square feet of space to operate a renal dialysis center at NYC Health and Hospitals Elmhurst, the facility, at an occupancy fee rate of $71 per square foot or $426,426 per year, to be escalated by 2.75% per year for a total of $2,252,666.58 over the 5-year term. This was presented to the Capital Committee on 10/18/2021. Christine?
Thank you so much, Chair. My name is Christine Flaherty, Senior Vice President of Office of Facilities Development. I'm joined by.
Hi, everybody. Good afternoon. I'm Helen Arteaga. I'm the CEO at New York City Health and Hospital.
So we'll start with the background.
So currently, Newton Dialysis Center is based in New York City and is licensed to operate outpatient renal dialysis center services at Elmhurst Hospital. Currently, they've been with us since 2002, and this will be the 3rd time they're renewing their lease with us. Currently, they operate several dialysis centers in New York City area and are currently working on expanding their services to New York City Health and Hospital Henry J. Carter. At Elmhurst Hospital, they operate about 25 hemodialysis stations in which treatments are provided to our patients outpatient as well. Newtown, the next slide. Currently, Newtown right now has about an average about 220 patients per month, which is about 25% decrease pre-pandemic. And currently, one of the things that they form a great partnership with Elmhurst is that they see our patients on a sliding fee program as well. So all of our patients have access to this type of work. And you're gonna go over that.
So as noted already, Newtown's been providing their services there at Elmhurst since 2001. This agreement's been renewed 3 times by the corporate board of directors and has been given space in December of 2016 being the most recent. Each year and each resolution delineated a cost per square feet, and that's been escalated over a number of resolutions similar to this one. The next slide. From a standpoint of giving you the board a sense of the dialysis services that are across the system, we have a combination of outpatient centers that are self-provided with services by H&H staff, as well as affiliates like Newtown providing dialysis at other sites and other organizations like Dialyze Direct and River Renal Dialysis for inpatient and outpatient at Bellevue. Next slide. So the terms for this agreement, Newtown would continue to occupy the space that they're in, the 6,000 square feet at the D ring of the main hospital space at the rate of $71 a foot for a total of the $426,000 and change per year. The rate is set at a fair market rate as indicated in our packet, and they are able to be renewed on an annual basis. The occupancy fee will have the continued general market rate of a 2.75% per year escalation over the 5-year term, with a total occupancy fee of over $2 million. Elmhurst provides some ancillary services, since this is very co-located within the hospital itself. Very minor elements of scope, but a little bit of services to this space to make sure they have the best care possible for the patient population. And finally, the last slide that summarizes our exact resolution language that the chair read into the minutes prior. Happy to take any questions. Thank you.
Any questions from board members?
Yes, it's Barbara Lowe.
Go
Hello?
ahead, Barbara. Yes.
Yeah, I have a generalized kind of question. For the immediate and the far future, will we remain under this type of arrangements, or will we ever become maybe part owner of our own dialysis system? We understand in the health field that dialysis will not reduce. It may increase, continue to increase. It's just a general question at this point. I guess Dr.
Barbara,
Katz, you can tell me if it's appropriate. Yeah.
Sure, Barbara. I think for the time being, we're going to continue the mixed model. So in some areas like at Harlem, we're able to do it ourselves. In other areas where there's somebody who can do it better than we can because of their other contacts, we'll let them do it, but we'll prioritize just making sure that our patients get it, which is what we think is most important. And I know that's what you care about, that the patients have access to it. And like with this at Elmhurst, it's actually on site. So the patient doesn't have to go somewhere else.
Yeah, maybe we can just look at the dollars and the potential
Will do.
for. Yeah, thank you.
Thank you.
Thank you. So let me then ask for a vote. Dr. Katz,
Yes.
Dr. Calamia,
Yes.
Dr. Morse,
Yes.
Dr. Cunningham,
Yes.
Philip Wadley,
Yes.
Scott French,
Yes.
Barbara Lowe,
Yes.
Robert Nolan,
Yes.
Sara Hernandez Piñero,
Yes.
Frida Wang,
Yes.
Benioski Peña Mora,
Yes.
Anita Kawatra,
Yes.
and I haven't been voting, but I vote yes. Forgot that I also
Thank you.
vote.
Thank you.
Thank you so much.
Thank you.
Take care of yourself.
So the next one is,
Okay. Resolution 3, adopting the New York City Health and Hospital Corporation's revised principles of professional conduct, which sets forth the system's compliance expectations and commitment to comply with all applicable federal and state laws. The POPC serves as the system's code of conduct as required by 18 New York CRR section 521.3 C1 and as recommended by the U.S. Department of Justice Criminal Division, Evaluation of Corporate Compliance Programs updated June 2020. The revised POPC also updates the system's gift policy as detailed in operating procedure 50-3, policy on gift exchange and receipt.
Good afternoon, everyone. Catherine Patsos, Chief Corporate Compliance Officer. Just as an introduction, as mentioned in the resolution, the POPC sets forth our compliance expectations and commitment to comply with all applicable federal and state laws. It describes our standards of professional conduct and our efforts to prevent fraud, waste, and abuse. It also serves as our code of conduct for our workforce members and business partners. It's required by social services law and regulation to have a code of conduct such as the POPC. I'm going to review some substantive changes in the POPC to let you know most of it was kept in its original form, but we did add a few things and change some of the language. The first thing we did was to add this paragraph under the overview regarding that the social services law requires us to establish written procedures that describe our expectations and embodied in a code of conduct, and that the OIG guidance, compliance program guidance for hospitals discusses the needs for these standards, and that CMS requires managed care plans and their participants to have a code of conduct. We also added, and you'll see the second bullet there, the italicized language. The POP serves as a system standard of professional conduct. The rest of it was already in that POPC. Next slide. Under the core objectives, we previously, the core objectives included the guiding principles section, as you'll see at the bottom of the slide here. And we substituted that for the iCare model because that is more current principles that we abide by. So under this section, it states that we uphold the values by continuously reinforcing 5 essential features of New York City Health and Hospitals iCare. And those 5 are listed there. Also in the core objectives, we changed the language that was regarding Metro Plus, and we used the updated employee handbook for Metro Plus and the POPC, the revised POPC, which replaced the prior language at the bottom of the slide regarding Metro Plus's goals and objectives. Under, next slide. Under the responsibilities of workforce members under the POPC, we added from the POPC frequently asked questions, fulfilling the system's mission and upholding its values, preventing, identifying, and correcting unlawful and unethical behavior and fraud, waste, and abuse, maintaining respectful, healthy, productive, and safe work environment, and delivering high-quality medically necessary care and services to individuals regardless of their ability to pay. Under examples of unprofessional conduct, we added new language regarding the conflicts of interest, which enumerated more specifically what some of the conflicts of interest apply to. The prior language had included accepting gifts or services from patients, vendor, or potential vendor. As I'll explain a little bit, that language was revised according to our new gift policy. Next slide. And under also examples of unprofessional conduct, a new subsection K, and this was, as I said, what we replaced in the policy of gifts. So it would be unprofessional conduct to fail to comply with the system's gift policy, including failing to comply with our OP 20-55 on pharmaceutical gifts and sponsored educational programs, our new OP 50-3 and the policy of gift exchange and receipt, accepting monetary gifts from a patient and or a patient's family member, or gifts that have more than nominal monetary value, and accepting gifts from a vendor, or potential vendor, or contractor of the system. This was changed to allow for patients and family members to give non-monetary nominal gifts to providers. Our prior policy on gifts prohibited accepting any gifts or services from a patient, vendor, or potential vendor. We also, under unprofessional conduct, expanded the unprofessional conduct regarding HIPAA and subsection N, It previously just had one statement there, and now we've enumerated 7 items that would violate HIPAA under the as unprofessional conduct. And under how to report issues or violations, we added language regarding contacting MetroPlus, Medicare, and Medicare plan sponsors for violations, in addition to contacting the Office of Corporate Compliance. So that language there instructs people how to report to other institutions and governing bodies on violations or issues of fraud, waste, and abuse. Next slide. There are a few technical changes. We changed the section headings in the table of contents to pose them as statements rather than questions. The sections were reformatted to enumerated and lettered and numbered format instead of bullets. We updated the address and phone number of the Office of Corporate Compliance. And in the stay informed section, we deleted language that related to issues that are not currently handled by the Office of Corporate Compliance, such as workplace safety and environment of care issues and discrimination and sexual harassment issues. Those are the changes to the POPC. And I do not have a slide on the resolution, I apologize, but I'm happy to take any questions.
Thank you, Catherine. Any questions from board members? Okay, so I would like to call for a vote on the resolution. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Morse?
Yes.
Dr. Cunningham?
Yes.
Philip Wadley?
Yes.
Scott French? Scott? Okay, Barbara Lowe?
Yes.
Robert Nolan?
Yes.
Sally Hernandez Pinheiro?
Yes.
Frida Wan?
Yes.
Fenioski Peñamora?
Yes.
Anita Kawatra? Anita? And Jose Pagan, yes. So resolution is approved. Thank you so much.
Thank you.
Okay, and the last one is Frida Wan. You want to read the resolution?
Yeah, sorry. Can you hear me?
Yes. Yes, we can.
Okay, great. It's resolution number 4, authorizing New York City Health and Hospitals Corporation, the system, to sign a contract with Creative Snow by Cow Bay, Inc., the vendor, for 3 years, 2 one-year renewal at the discretion of City Health and Hospitals Corporation to provide removal services for a total amount not to exceed $6,920,000 for the period November 1, 2021 through October 31, 2026. This was presented and discussed at the Finance Committee meeting on October 18th, 2021, and approved and brought forth to the full board today.
Good afternoon. I'm Joe Wilson, Senior Assistant Vice President of Strategic Sourcing. New York City Health and Hospitals requires professional snow removal services during the winter season. The current contract for snow removal expired October 14th, 2021, but was extended through today's meeting. The existing contracts are with Mac Industries and Creative Snow by Cow Bay. The current vendors do perform landscaping services, but we have decided to bid landscaping separately to create more opportunity. Creative Snow by Cow Bay currently provides the snow removal services for 74% of H&H facilities, and NAC had taken care of the remaining 26. Snow removal services in the scope include acute care, Gotham, and long-term care, and the previous fiscal year spend was $1,193,853. And the proposed contract term is 5 years, 3 base years, with 2 one-year options to renew at the discretion of Health and Hospitals. The quick overview of the procurement is on July 6th of this year, the CRC approved an application to issue the RFP. It was posted to City Record on July 23rd. The RFP was sent directly to 18 vendors on the 27th. We had 5 vendors attend the facility walkthroughs August 2nd through August 6th. And on August 10th, 6 vendors had attended a pre-proposers conference call. And on August 26th was the proposal deadline, and we'd received 5 proposals. On September 28th, we had met as a committee, and Creative Snow by Cow Bay was the highest rated proposer. And simply the minimum criteria was 5 years in business, an MWB utilization plan or certification. They needed to show a strong New York City presence with New York City customers, $3 million in annual gross sales, and multiple references of other large commercial real estate customers. And our substantive criteria was 30% cost, 30% substance of vendor's proposal. The 20% was the appropriateness and quality of firm's experience, and 20% MWBE, and a strong evaluation committee of 3 chief operating officers, 2 central office OFD representatives, a senior associate director, and 13 facility representatives. Just quickly, the vendor performance has really been excellent. This has been verified with several interviews with facility COOs, and they strongly recommended continuing the or awarding the contract standardized to Cow Bay. Some of the things that really had stood out in the selection process is Creative Snow by Cow Bay also has a construction business, and these team members who are not working during the winter gives them the opportunity to flex up more resources during heavy snow. They have prior experience with many large customers. They had a banking system that had over 180 locations in the tri-state area. They've made significant investments in the GPS technology of tracking their equipment and their employees to make sure they're in the right location at the right time. And as stated before, strong track record over the past several years with many of our institutions. Supply Chain Services seeking approval to enter into contract with Creative Snow by Cow Bay for snow removal services for a not to exceed number of $6,920,000 with a 3-year contract term with 2 one-year renewal options at the discretion of H&H. Creative Snow by Cow Bay has met the MWB target of 30% with both partners for labor and equipment. Those are the identified MWB partners in their plan, Serrano Fence and Son, KES Construction, and Chief Equipment. Okay.
Any questions from board members?
I would like to, just 2 quick questions. NAC Industries performed 26% of the removal services under the old contract.
Yes.
2 questions. Will Creative Snow by Cow Bay be able to cover that now? And did NAC Industries, were they one of the 5 vendors?
They were one of the 5 vendors. And yes, we really didn't understand the full capabilities of Cow Bay. So besides these large banks, they actually have the contract for LaGuardia Airport. So they're a huge company that we weren't probably really exercising. And one of the great advantages of this is now that it's standardized, kind of a more standardized communication and response. So in all of our indications in our back, like regarding their fleet of trucks, their amount of people, their presence in New York, I think we're in very good hands.
Okay, thank you.
What if, unfortunately, we all pray for, we have a light winter and we have minimal amounts of snow? Do they still get paid the maximum 6.9 million?
No, well, so there's 2 forms in the way the contract is written. There's a minimum amount you pay them each month, so they're your primary vendor. And then it's an escalator based upon the severity of the snow. So there is a flat fee that we're going to pay, but if it's a light winter, we pay less. If it's a heavy winter, we will pay more. The 6.9 million is really based upon this aggregate of our last few years of our contract and trying to put together a strong budget of a heavy year and a lighter year. But yes, if it doesn't snow, there is a minimum amount we'll pay them monthly through the season.
Thank you. Any other questions? Okay, so let me call for a vote. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Morse?
Yes.
Dr. Cunningham?
Yes.
Philip Wadley?
Yes.
Scott French? Barbara Lowe?
Yes.
Robert Nolan?
Yes.
Sally Hernandez Pinheiro?
Yes.
Frida Wan?
Yes.
Fenioski Peña Mora?
Yes.
Anita Kawatra. And Jose Pagan, yes. So the resolution passed. Thank you so much, Jay.
Thank you.
Then let me see where I am. 1 second. I participated in the joint, just to comment that I participated in the Joint Commission survey at Kings County on October 8th and Coney Island on October 15th. And I would just like to say that it was very impressive to see the work of the leadership and staff at both facilities, and it's just very proud. It makes me very proud all the comments that I hear from the surveyors and the feedback that we got on both facilities. So thank you for all the hard work that you all do. Thank you, Kings County and Coney Island. So VENDEC approvals. Since we began the process of approving contracts prior to VENDEC approvals, there is one item on today's agenda requiring VENDEC's approval, and he has that approval. There are 9 items from previous board meetings pending VENDEC's approval. Since we last met, we have received 1 VENDEC's approval. We will continue to notify the board as outstanding VENDEC's approvals are received. So we now move to the president's report, Dr. Katz.
Sure, and Chair, I'm not going to read the whole report. There are 2 things I want to talk about. First, let me do the more public notification that I've approved 2 contracts given their time insensitivity that would otherwise have been brought to the board, and I want to summarize them. One exception was an extension of our contract with Procure, an agency which specializes in reviewing the invoices of contractors to assure the documentation of their charges is complete and the invoices are in a form acceptable for federal reimbursement. Procure was originally contracted July 1, 2020. We have extended the term of the agreement through June 30, 2022 with the not to exceed amount of $6,395,400. The second exception was a contract amendment with Optum Insight Inc., who has provided call center support for COVID contact tracing and a vaccination scheduling campaign, along with Optum subcontractor McKinsey, who has provided operational support and leadership for the Trace Contract Center, and more recently, the Delta Variant Management Strategy. This contract amendment is to extend their support through December 2021 at an additional cost of $6.6 million as part of our community testing program. Funding for these services is provided through OMB. On the more important policy note, I want to just talk about how well the staff mandate for vaccination went. I know there was a tremendous amount of understandable worry. How would we function in our hospitals, given the number of people who were unvaccinated at the time that the vax mandate was announced? And just to say how amazing the health and hospital staff were, that overwhelmingly at all of our institutions, people got vaccinated. And we have passed 94%. We have actually been able to end early our contract for additional nurses, contract nurses, because we have not needed them, because so many of our nurses went forward and got vaccinated. And in any of our institutions, the number of people left unvaccinated is very small, and those people are either have a medical exemption, a religious exemption, or they are simply not getting paid right now on leave. We've worked out arrangements with our labor unions for a very respectful parting of the ways between people who don't want to get vaccinated. And in general, I think it's just gone really well. And I think for all of society to consider the role of mandatory vaccinations as a way of keeping each other safe. The death of an American hero, Colin Powell, last week, a son of New York City, born in Harlem, lived in the Bronx, went to school there, son of Jamaican immigrant parents, amazing leader throughout his life. He died of COVID because he had multiple myelomas, now has been revealed. Not a serious cancer necessarily, but one that prevents you from mounting a robust response to vaccination and to COVID. And there will always be such people in our midst. And so certainly for healthcare workers who are coming in contact with people who may have immunosuppression due to renal transplant or autoimmune diseases, or just as a community responsibility for each other, that there is the issue of, for the person, do they feel at risk from COVID? But even if they don't feel at risk for COVID, there is a risk that their being unvaccinated poses for those people who either cannot get vaccinated because they're very young children. We're looking forward to the approval of Pfizer next week for 5 and over, but that will still leave the under 5 unvaccinated. And those people who have chronic illnesses that prevent them from mounting robust responses to vaccination, that it's everybody's responsibility to protect those other people. So with that, Mr. Chair, there's my report.
Thank you, Dr. Katz. Any comments or questions from board members?
I just had a question about the term of the contract amendment for the 2 companies that work with test and trace. I see the amount, but I don't think I saw the term. When did it
The
start?
first one,
The second,
the second one, when did it start?
right.
That's, so it's to extend through December 2021. Can you look up,
Yeah, I can.
Andy, when it started?
Okay, it's fine.
We know it wasn't a long time ago because it was for COVID contact tracing.
Right.
So I think we can guarantee that it was not before, June or July of 2020.
Okay.
And even more than that, because it was signed recently, it would have started recently, right? This is sort of a relatively short period that it covers once we have the date.
I would guess 6 months or something, but
Did you have
it's
any?
fine.
Okay.
Yeah.
Any other questions from board members
Yeah.
for Dr. Katz? Thank you, Dr. Katz, for your report.
Mr. Chair.
So the committee and subsidiary reports, were emailed to you and in your folders for your review and submission into the record. So is there any old or new business to come before this board? If there's no further business, I declare the NYC Health and Hospitals Corporation Board meeting adjourned. Thank you so much.
Thank you.
Bye.
You should add the
Great
same
meeting.
hour to your November meeting.
Thank you. Thank you. Bye-bye.
Right, Codicia?
Bye.
They should all take this hour for the next meeting.
Yes.
Yes. Christine has
She's gonna do us in.
46 facility issues for your November meeting that